and did a tremendous job on surveillance and finding cases and vaccinating and doing all the things that need to be done. So India has tremendous capacities. All countries have tremendous capacities. When communities are mobilised, when civil society is mobilised, when, as the Director General says, heads of state and governments drive an all of society approach. There are no silver bullets here. There are no easy answers. If there were, we wouldn't be having to work so hard. We've got measures we can take now while we wait for other solutions, and we must take them now. So it's exceptionally important that countries like India lead the way and show the world what can be done, and do as they have done before. Show that aggressive, sustained public health action from community right the way through to head of state can have a profound effect on the trajectory and the outcome of this pandemic.
Thank you, Dr. Ryan. The next person on the line is Peng Wei from the People's Daily. Peng Wei, are you on the line?
Yes, thank you. Can you hear me?
Very well. Please go ahead.
Yeah, thank you. This is Peng Hui Zhang with People's Daily of China. Some American officials, including Secretary of State Mike Pompeo, criticized China for its handling of COVID-19 in the early stage and continue to call COVID-19 virus as Wuhan virus or Chinese virus. So what's the WHO's comment and position on that? Thank you very much.
I think we've spoken on this issue at a number of press conferences, and I think WHO's position on this has been clear in the past, and is clear now. And I think at this point it's not a core issue, and it's an issue that, quite frankly, is a distraction right now. So I think we need to focus on what we need to do now. There is no blame in this. There's only a future, and we choose the future, and we have capacities to fight this virus. It is affecting, as the Director General said, almost every country on the planet, every population. And it's not just communities, it's everyone can look around at sons, daughters, mothers and fathers and see who's at risk. We need to fight this thing together. And I will reserve any comment for later regarding blame.
Thank you, Dr. Ryan. And now we have Gabriela from Mexico on the line. Gabriela, can you hear me?
Yes, yes. Thank you for taking my question. Gabriela Sotomayor, Mexico, Proceso. Dr. Tedros or someone on the panel, if they can answer, how far behind is testing versus the real spreading of the virus? I mean, is it 10 times, 100 times? What is your estimate? Are we only looking at the tip of the iceberg?
So thank you, Gabriela, for the question around testing and highlighting the importance of testing. So with any new virus, I think what is the most tremendous story here, and I don't think any of us have ever seen the speed at which testing has been developed for a novel pathogen. So as you know, this new virus was identified within days. The sequence was shared a few days later, and because of that, testing began really across the globe. And with the sharing of the sequences on public platforms, labs all over the world were able to develop assays. And in doing so, the amount of production for testing grew exponentially across the globe. Of course, we always need more testing. Of course, we always need more labs, but that's the case for every pathogen, especially an emerging pathogen. What we are seeing now are countries finding ways in which they're trying to improve the production, the availability, the access, the sharing of these assays so that more testing can be done. And what we need are all countries to be focusing on testing as part of a comprehensive strategy. And we've mentioned what that strategy entails. That strategy includes public health measures, it includes physical distancing, it includes a strong government approach, it includes mobilizing the population, it includes every single individual knowing what they have to do to fight this pandemic. And we've outlined what that is before. And testing is a critical part of that. But every day we are looking for ways in which production can be increased, in which more labs can be available to do those testings, and that testing can be done faster so that we know where this virus is and that we can fight it without being blindfolded.
And again, just to qualify that, the virus was isolated on January the 7th, and it was the whole genome sequence was shared with WHO and the world on January the 12th. It's just 12 weeks, or 10 weeks ago, sorry, not even 12, 10 weeks ago, since we had a genetic sequence for this virus. The fact that so many tests are out there, the fact that there are so many testing platforms available now is a remarkable success for science, for collaboration, and for public-private partnership. So, yes, of course, it is very difficult to go to absolute scale on testing, while at the same time maintaining quality and maintaining the validity of these tests has been extremely important. So the question you specifically asked, there's no question in some countries that all cases have not been detected, and that's been the case in most countries. But what we've seen is a huge catch-up in testing in most countries. And we want to see more. We do say, and the DG has said before, test, test, test. But again, we're not talking here about testing everybody in the community. We need to focus on two priorities: making sure that suspect cases are tested. That is absolutely the central priority. And obviously, that people presenting in hospitals with clinical symptoms of pneumonia who are entering the system are also tested as a priority. There would also be suspect cases. We would also like to see contacts of cases who are unwell or showing symptoms, that they also be tested. The measures we have in place now, many countries have in place of movement restrictions and people staying at home and physical distancing. All of these measures are helping to, in some senses, dampen down and push down the intensity of the epidemic. But if we have to work our way out of this situation, as we gain some success with those strategies, we have to be able then to identify who is infected and be very, very quick and agile at identifying who's infected at community level and ensuring that they are isolated. So testing is important now, but testing will become even more important in the coming weeks, not less important. So we all have to work hard. We're working very, very hard with both public and private sector partners, as are all governments, to scale up and make testing more available and to push testing right down through the system. But that has to be done with an eye on quality and ensuring that those tests are the best and highest quality.
Thank you, Dr. Ryan. I now have, we're really running out of time, so only two more questions. We'll take one from Kai Kufer-Schmidt. Kai, are you there?
Yes, thank you very much for taking my question. I wanted to ask about the strategy that we're seeing in some countries. I mean, UK has talked about it, the Netherlands are suggesting it. And they're basically trying to find a balance between shutting everything down to suppress the virus and letting it spread at a very low level in order to have some semblance of normality. I'm curious whether the WHO, I mean, you know, you've talked very little about the end game because you're concentrating on what's happening now, but I'd really love you to address a little bit how you see the future, you know, for all of these countries that are in a shutdown now. How do you, you know, see this proceeding?
Thanks, Guy. You are correct that this is a very, very important issue, because as so many countries around the world have gone into this mode of people staying at home, of movement restriction, countries are obviously and justifiably concerned of the social, psychological and economic impacts of those moves. Countries are doing their best to suppress infection and take pressure out of the epidemic and, more importantly, off the health system. But we do know that that is very difficult to sustain. And therefore, how are we going to turn that around? And the DG said it. How do we move from what is a defensive mode into an offensive mode? How do we move from trying to avoid the virus to actually going after the virus? We've seen this in Ebola, we've seen this in polio. There is a moment at which you have to step forward and go after the virus. In order to do that, and we've seen examples in places like Singapore and Korea where governments haven't had to shut everything down. They've been able to make tactical decisions regarding schools, tactical decisions regarding movement, and been able to move forward without some of the draconian measures. But they've only been able to do that because they have had another weapon, and the other weapon they've had is highly aggressive case finding, contact tracing, community surveillance, isolation of cases, quarantining of contacts, testing of contacts if they get sick. They've put together a comprehensive public health toolkit which they're able to match with their more society-wide measures like movement restrictions. And we're working extremely hard. Our Strategic and Technical Advisory Group for Infectious Hazards is working with us right now, looking at those strategies to move forward from where we are now. And governments need to use this, to use the DG's word, second window of opportunity. All that we get from movement restrictions and people staying at home and all of these measures, we buy some time. We take the heat out of the epidemic or the pandemic. We buy some time, but we then need to find strategies and tactics that get us to move forward. And we have to make those decisions. Each government will have to make those decisions. We're working hard to provide advice to governments on how to do that. But very, very clearly, in order to move forward, a scale-up, and I mean a massive scale-up, in public health capacities to do case finding, isolation, quarantine of contacts, and being able to go after the virus rather than the virus coming after us is one of the key ways we can move forward. And we'll be coming back to governments and in public around our advice on this to governments. There is a very, very precious window now in which we can prepare to do that.
Thank you very much, Dr. Ryan. And our last, but certainly not least, we have Helen Branswell.
Oh, thank you very much for taking my question. This is probably for Maria. People are reporting a loss of a sense of smell. I don't know how frequently that's been seen. Can you give us any indication of whether that is actually a reliable marker of infection?
Yes, so yes, we've seen quite a few reports now